All right, well, good evening, everyone. My name is Marjorie Willner. I work as a data scientist at Accenture Federal Services. Today, I'll be talking about our work on the daily predictions of COVID-19 cases. I don't think COVID really needs an introduction, but I'll talk a little bit about our motivation behind our work. So if you look at this map here in the bottom right-hand corner, it shows the number of cases back in March. If you can think back to that, actually March 8th. And what kind of sticks out is that there's only 545 cases in the whole entire United States. So at that time, there was a lot of questions, but there wasn't really much known about the virus and how it was spreading. There was some initial data, but we didn't really have any surveillance in the US and minimal testing. So we were interested in creating a lightweight model that could use the data that was at hand to start making predictions about the spread of COVID and to address questions that policymakers were having. So key things besides the minimal data inputs is we wanted a model that was could account for variation in location, right? If we look at this early map, I think we can all remember there's these isolated hotspots, especially in New York and in the Seattle area. And then eventually we saw different implementations of non-pharmaceutical interventions, such as school closings, business closings, and then the various reopenings over time. So we wanted a model to account for that. We chose a 4-compartment deterministic model, a susceptible, exposed, infected, removed SEIR model that only requires a time series data set and 3 disease parameters. In this model, I'm just going to change to a different view. An individual can only be in one of these 4 buckets here. So some of the key parameters are the latent period moving from the exposed to infectious bucket, gamma, the infectious rate moving from infectious to removed, and that removed encompasses both people who recovered and those who have unfortunately died. And I just want to pause here. We talked a little bit about data quality throughout the day, and think about what it really takes, especially at the beginning, from someone to go from being infectious and having symptoms to their cases actually recorded. So if you look at this diagram at the bottom, we say, right, you can think of you're infected, you then first showing symptoms before you seek care, you get a test, and test results may come back in a day, 2 days, 5 days, and then that case, that reported test actually then has to propagate up the line to then be reported. So it's just something to keep in mind and something our team has thought a lot about. And the last kind of transition, which I'm mostly going to talk about, is moving from the susceptible to the exposed compartment. That's beta here. And what's encompassed in there is this R value, or the reproduction number, something you probably heard a lot about at the beginning, or if you've been steeped in this work. So just to do a brief recap, we have something called the basic reproduction number. And this talks about the spread of an infection through a fully susceptible population. And that's kind of key. So in this graph I'm showing here on the x-axis, you have time. So these are just time step. You can think of days. On the y-axis, you have the fraction of the population. And we have our 4 different buckets, right? Susceptible, exposed, infected, and removed. And so we have these 3 kind of different regimes we talk about when we talk about the reproduction number. When R0 is less than 1, that's really where we want to be, where the epidemic dies out. Our R0 value, where it equals 1, that means if you're sick, you're likely just to get one other person sick. And the spread kind of propagates through and maintains itself. But where we really don't want to be, and the purpose of social distancing was to keep us away from this R0 value greater than 1. And that's where the epidemic really takes off and spreads. And you can see in this last graph here that the fraction of the population that's recovered becomes higher than the fraction that's susceptible. That means almost everyone has gotten sick. As I said, though, this only holds for a fully susceptible population. So what we talk about on a day-to-day basis is the time-varying reproduction number. Here we're showing the mean reproduction number for Virginia. That's where I live. On the x-axis, you have time. On the y-axis is the RT value, and you can see the value. Each dot represents 1 day, and I just have the line there at 1 to show you kind of the value that we're aiming for. The RT value is calculated based on 2 different values, the serial interval, which talks about how generations of cases are propagated, so how long it takes, and also the data on the ground. And that's kind of the case data, that's kind of where we bring in this temporal variation, right? So if people are not mixing with each other, cases aren't spreading, the RT is going to decrease. I should say these RT calculations, which I'll talk more about on the next slide, were all done using the EpiStem package by Corey et al. It's a great package. And what this package uses is the maximum likelihood function. And because of that, we can start looking at the 5th and 95th quantile here to kind of see a range. You can just think about this as the max and min that kind of bound our values of RT here. And the reason, or one thing I wanted to point out, is that we can't look at RT in isolation. We have to look at it in conjunction with the daily cases. So what I'm showing here is Vermont, which has very low cases, which is great. We can see this huge spike in the RT value right after June 1st. And that's because they had a spike in cases. But you can see here their spike in cases maybe from about 5 new cases to 30. So it seems very minimal when we talk about the rest of the country. But since there are so few cases, just a few more make a huge difference. So we can think about going from 1 to 2 cases, right? 100% change. We also have to think about the RT value with the cases, because having an RT value, I'm showing Florida and Arizona, 2 places that have been of interest, of 1 means something a lot different when you have 10,000 new cases a day. So you may be going from 10,000 to 20,000 new cases versus 5,000 cases a day when you're going from 5,000 to 10,000. Just want to point out in both of these, there's about a 2-week lag here, which I showed in the way we think about cases propagating through the system. So that's pretty interesting. So what do we do with all this data? Well, we try to make predictions, or make predictions on a daily basis. So every day we make for every state, DC and Puerto Rico, and for every county, which I'll talk about in a second. So what I'm showing here on the X is the cumulative cases. So on the X-axis, we have time, Y-axis, we have cumulative cases. And while we understand that what's the data that we're getting from GHU is imperfect and is probably an undercounting due to asymptomatic or people not getting tested, our goal really was to create a model that matched the number of cumulative cases and what was being reported. So in black is the GHU data, and in the red and blue is the max and min projections, again, based on the intervals that we're interested in. And we can also look at the daily cases here again for Virginia, just the change over time. Wouldn't be that interesting if I didn't show you what the real data was. So in this case, I captured it pretty well. I'll talk more about our model performance in a bit. So while the state is interesting, a lot of policymakers and people want to know what's happening in that county. So while we could just apply our model and we thought about applying it to the county level, we couldn't do it 100%. There were some changes that we needed to make. And that was because we could not calculate this RT, what I was just showing you for every county. So this histogram is showing 2 different things to think about. On the left-hand side, we're looking at the number of counties in the United States, split between rural and urban. This was kind of a talking point and actually turned out to be significant, talking about the difference between the spread in rural and urban counties. So most counties in the United States are rural. But if we look at which counties we can make RT predictions for, more of the urban counties we can make predictions. So what you're seeing here is that of the almost 2,000 rural counties, we can only make RT predictions for about 30%. For all the urban counties, we can make predictions for 64%. And that's because a lot of counties have low case counts. In this case, the maximum likelihood function doesn't converge and give us what we need. So what do we do in these cases here? So the naive approach was just to default to the statewide RT, but we found that this tended to overestimate in rural areas what the actual spread was. So the informed approach was to make distinct estimates for the rural and urban counties at the statewide level. So instead of what I'm showing here and what I showed in the other graphs for Virginia, just taking all the cases, the new cases each day for the whole state of Virginia and calculating the RT or whatever.
5 minutes.
To add up all the cases in either all the rural counties and make a prediction or all the urban counties. And you can see when I overlay the RT value for the rural counties, it looks a lot different. And when I add in that for the urban counties, you can almost see no change, right? It looks almost identical. And it's not surprising that the overall RT is biased towards the urban counties. So with this, we start to make predictions at the county level. We make predictions for every single county in the United States. On the left-hand side, again, I'm just showing you the cumulative cases. Here's for 2 different counties, Alexandria City, which is county equivalent, which is urban county that we have an RT projection for, and Amherst County, which is a small county in Virginia that is rural and don't make RT projections for. I'm also showing the daily cases here. I'm then showing the fit over time, and we can see we underestimated in all cases. But what's great and interesting about our model is we update it every single day so we can account for these changes, right? And we wouldn't expect it to be perfect all the time, right? We're predicting over many places, and we just want to get a sense of what's going on. And of course, because there's more data, it's stable. If we look back at our state level predictions, here we're looking at two measures of performance, the mean absolute percent error and the root mean square error. We have good performance. So at the top panel here, we're showing the model that I've been showing you, the model with AF parameters. The bottom is the consensus model parameters, so those from other federal agencies, and our MAPE and root mean square is lower. So the root mean square, just to point out, indicates we have more accurate predictions. We're not into sugarcoating what we're doing, and so of course when we have low counts, we have our model doesn't perform well, right? It suffers. It's hard to predict when you have low case counts, and the variations really make a difference. We also have issues if the outbreak is driven by importation, right? If the cases aren't propagating in the local community, but let's say a large cluster is coming in from somewhere else. And finally, I just wanted to point out the difference of performance on the long term versus the short term. So here we're showing projections over 21 days. So at the top, we're showing our prediction from August 2nd over the course of August, at the bottom from August 12th. And when we predict over a shorter time period, which is in the bottom graph, our model is more accurate, which is what we would expect. But again, since we're continuing to, we can adjust for these changes, some of them which we can predict and some of them which we can't. So in conclusion, we provide accurate and easy to interpret near-term forecasts of COVID-19. We really focus on having an accessible model that's explainable. That's key to having people understand what's going on. And we also have daily forecasts at state and county level that are sensitive to on-the-ground behavior, right? Because we're looking at the time series of the case data, and we have a forthcoming package that's called SEIRDynamic that will allow users to model any disease spread at multiple administration levels, like we're doing here at the state and county, with minimal overhead. And I just have this graph here showing that, right, we have places that have over 1,000 new cases in the last 14 days per 100,000, and there was a day in March where we only had 545 cases in the whole US. It's hard to believe. I just want to acknowledge two of our colleagues who are key to data engineering, Jared and Irfan, also the Midas Network, who's been great for collecting data. If you haven't gone to visit their site, they have this huge collection of parameters from different literature, and of course, Johns Hopkins, which is where we've been collecting all the data. And with that, I'll take any questions.
Thank you. I don't see any questions in my list, but I do have one for you.
Sure.
Is it possible to combine forecasts from different types of models? So suppose I just did a simple exponential smoothing. When I'm looking at your time series, I'm thinking I can just do an exponential smoothing on that and maybe forecast well. And then you have your forecasts that come out of the EpiStem and other models that you are using. And usually combining forecasts in time series essentially says, let me weight each forecast, yes, inversely by the error prediction error, and then combine the forecast. It was big in the late 1970s and so on. What do you think?
That's interesting. So we are using the EpiStem package to make prediction for RT, but the actual prediction of the number of cases, we have our own model. I think that's interesting. I think that's interesting. I can imagine, and I hope someone will work on making a forecast kind of like the weather models where you bring in multiple different forecasts and moving forward. But I know a lot of focus in those models has been in deaths. But yeah, I'd be happy to discuss more in detail with you.
Thank you.
At that point.